What if a 30-year birth dose hepatitis B policy collapses after a reconstituted panel? Who wins? Who loses? Maya will ground us in patience and public health risk. Leo will pick apart process and motive. Jim O'Neill's imminent sign-off makes this a national emergency with children at stake. I'll use a news summary to set the verified timeline and facts for my narration. I'll use transcript 1 to shape Maya's urgent critique and personal testimonies. I'll use transcript 2 to shape Leo's skepticism, media bias points, and anecdotal pushes. Transcript 3 is unavailable. I'll note gaps when we reach and answer questions. This week, ACIP voted to roll back a 30-year policy. The automatic birth dose of hepatitis B would shift to a case-by-case discussion if the mother is negative, pending sign-off by Jim O'Neill.
Look, this wasn't a quiet scientific debate. The panel was reconstituted by the secretary. Anti-vaccine voices dominated. And we heard attorney Aaron Siri pushing debunk claims, a direct attack on decades of public health progress.
Hold on, supporters frame this as restoring choice and scrutiny. People point to MAHA grievances, high costs, pharma influence, and loss of trust during the pandemic. That political reality matters to millions.
Choice shouldn't mean dismantling protections. Experts warned we'll see more chronic hepatitis B, more cirrhosis, and liver cancer. These aren't abstractions. They are children's lives and long-term suffering.
I get the human cost, but there's also a failure to engage legitimate public concerns. Dr. M.C. Carey said, "The government is not your doctor," somewhat nuanced conversations, not blanket mandates that feed distrust.
We need to name the contradictions. Aaron Siri claimed childhood vaccines were never tested against inert placebos. Researchers point to hundreds of trials and major reviews that contradict that. That's a factual dispute we can't ignore.
And while we debate, the mechanism of harm is clear. Half of U.S. kids rely on the Vaccines for Children program. If federal purchasing follows these weakened recommendations, the poorest and most marginalized could lose access.
Also real, the process looked politicized. Insurance in some states have already signaled they'll ignore this panel. And yes, there are conflicts. Legal actors like Siri stand to profit from litigation, which raises its own questions.
So the central unanswered questions are procedural and scientific. Who was invited? Whose evidence was considered? And will Jim O'Neill uphold or reverse the vote? The outcome could reshape infant immunization.
We must center patients' stories. Clinicians warn of preventable deaths. One doctor recounted a young scientist lost to liver cancer from hepatitis B. That memory argues for prevention, not experiment.
And I would demand accountability on all sides. Scrutinize conflicts, engage communities honestly, and let clinicians have meaningful conversations with families rather than top-down rhetoric.
The administrative sign-off is imminent. Political and legal responses are likely. And clinicians and families must prepare for uncertainty. We'll follow who signs, who fights, and what this means for public health next.